Hi, I'm Dr. Mark Tam, hair transplant doctor here on Harley Street. I have the pleasure to share with you this clinical case, Ryan, an actual patient of mine who is looking for hair transplant treatment for his receding hairline. Let's hear from Ryan himself.
My name's Ryan. I'm a freelance graphic designer from London. First started noticing my hair loss when I was about 21. I got my first job and it came with a lot of stress. And I noticed my temples receding and thinning. By the age of about 25, my crown area started thinning. When I was about 26, last summer, I decided to do something about it.
When we are planning Ryan's treatment, we had his personal goal in mind, which is to thin the temples and lower his hairline. In this design, you can see the hairline shape is much stricter. We bring his temple forward. We also work on his temple points to make it a little bit more balanced. Now we have the design. How much work do we need to do? By using treatment area mapping and measurements, we can precisely calculate the exact amount of hair follicles and graft number we require. Area measurement is clinically proven to precisely calculate the surface area, graft required at a specific density. Preparation is the key to success. Better planning leads to better results. Now let's have a look at Ryan's results. We can see the treatment area has achieved a successful improvement, resulting in a much more youthful look. We achieved Ryan's personal goal to fill in his temple and a much more natural, fuller looking hairline. The coverage at the temple is now restored. His hairline is now lower and stricter. His temple points now is a more defined edge and slope to it. The transplanted area looks natural with minimal sign of work done. The density at the transplanted area has minimal difference to the rest of his hair. The hairline forms the upper border of the face and is framing his face much better than before. Density matters, but looking natural is equally important. The type of grafts that we use will dictate the final results. And this is how I do the temple points. Keeping it natural, keeping it soft, keeping its flowing directions. Look at Ryan's final result here. Natural, hardly any telltale signs unless you look super up close. Even I can hardly spot it. It's easy to neglect the donor area. But what's good if you have a good hairline and a poorly harvested donor? Ryan's donor is in excellent state. That's after nearly 2,500 hair follicles, grafts harvested. With minimal scarring, he can wear his hair short or long. And if he needs further treatment in the future, we should have sufficient availability. When Ryan came back for his review, we took a scalp microscopy of his hairline area. Here, we work out the density by counting the amount of hair follicles in a given area. Density is 50 grafts per cm square. That is fantastic growth and improvement. And look at Ryan's new hairstyle. Previously, he was starting over his temples and hairline to cover the concerned area, somewhat limited in his hairstyle options. And now he's starting it up and back. What a statement of confidence. And I just love how great it looks.
Having a hair transplant makes me feel a lot more confident. I can have my hair cut the way I want to have it cut. I can style it the way I want to style it. I choose Dr. Mark Tam.